Welcome to the HERHealth podcast, transforming health for women and girls at risk, where we empower women and girls to take charge of their health and well-being. Join us as we shine a spotlight on issues affecting women and girls' health and explore ways to create positive change. Get ready to be inspired and empowered as we discuss health, advocacy, and empowerment for women and girls at risk. Please be advised that this podcast may cover sensitive topics such as gendered violence. We understand that these discussions can be difficult to listen to. If you feel uncomfortable or need support, we encourage you to prioritize your well-being. Consider exploring our other podcasts if these topics are triggering for you. Resources can be found in the description.
Good morning, everyone, and welcome to today's AVA HERHealth podcast. I'm your host, Jason Novick, the AVA webinar coordinator. Today, we're joined by Dr. Alishau Diebold, Assistant Professor at Mount Royal University in Calgary and the Faculty of Health, Community, and Education. Her work is grounded in social work and driven by a commitment to community-led change, cross-sector collaboration, and transforming systems to better support those most impacted. Today's episode of the podcast focuses on a critical and evolving issue, approaches to youth violence and radicalization prevention in Canada through a public health lens. Across the country, we are seeing increasing concern around violence and radicalization as part of a broader social and health poly-crisis. These challenges are not isolated. They are deeply connected to structural inequities, social determinants of health, and systemic gaps in prevention and support. In particular, young women, especially South Asian women aged 18 to 25, face unique and often overlooked vulnerabilities. Without culturally responsive and gender-sensitive approaches, these young women may experience increased risks of victimization, re-traumatization, and even criminalization. In this conversation, we'll explore how shifting from a security-based approach to a public health framework can reshape how we understand and prevent youth violence and radicalization. Dr. Diebold, thank you so much for joining us today, and thank you for your recent AVA webinar presentation on this topic.
Thank you so much. It was such a joy to present, and I'm really honored to be here today with you.
Thank you. I appreciate this. So first, I'm wondering, in your presentation, you emphasized shifting from criminal justice responses to a public health lens. What does that shift look like in practice, and why is it so important for addressing youth violence and radicalization?
And this is a great question. This is one of the most important paradigm shifts of our time. For many years, even decades, many societies have approached violence primarily through a criminal justice lens. That model asks, who committed the harm? How do we punish them? Those are necessary questions when harm occurs. Accountability matters, right? But they're incomplete questions if our true goal is prevention. A public health lens asks a deeper, more strategic question. It asks, what conditions make violence more likely in the first place? And how do we change them before it occurs? And we already use this type of logic in medicine. If a population experiences a high rate of heart disease, we don't just build more cardiac services and interventions. We also look at studying nutrition, impacts of exercise, income inequality, and other prevention mechanisms. And so violence, or the occurrence of violence, should be treated with the same type of intelligence. In practice, this means understanding violence as shaped by social determinants, including childhood trauma, family stress, housing insecurity, social exclusion, different health conditions, lack of opportunity, and this breakdown of belonging as well. And so these are just conditions that evidence tells us matter. And so when we think specifically about youth violence and radicalization, the public health approach becomes even more urgent. Adolescence is this period of identity formation. So young people are at this stage asking really serious and profound questions. Who am I? Where do I belong? These are all questions that are occurring. And so prevention looks like investing in mentorship, safe schools, digital literacy, family supports, and more responsive mental health services, supporting youth employment, and creating community spaces where identity can be explored safely. And so this means early intervention. And Canada has the capacity to really lead globally in this area because we understand collective well-being through universal patterns. And so the next evolution is recognizing that safety is a health outcome and a justice outcome. And so if we only respond after violence, we remain trapped in reaction. And if we build the conditions that make violence less likely, we really can begin to transform our future.
Thank you. Thank you so much for elucidating for the podcast audience one of the overarching themes of your presentation with your emphasis on a shift from criminal justice responses to a public health lens. And in your work, you often invite audiences to visualize the daily realities of young South Asian women. And I'm wondering, how does centering lived experience change the way policies and interventions should be designed from your perspective?
Yeah. For me specifically, from my professional perspective, when we center lived experience, our policies become more honest, right? It stops assuming people move through systems in these neat, uncomplicated ways and begins to recognize the real emotional, cultural, and structural complexity of our human lives. And so when we think about a South Asian woman experiencing violence, she may seem to also be navigating university pressures, economic stress, caregiving expectations, intergenerational trauma, many different other pieces, right? And so she may deeply really love her family while also being harmed within that same family system or maybe at that stage. And so that contradiction is actually very important, right? Because too many interventions force false binaries, right? Leave or stay, victim or empowered, tradition or freedom, family or independence, right? And life is much more nuanced than that. And so lived experience teaches us that many women are not accessing services because they are passive or uninformed. They're actually making highly rational calculations about risk, right? And so when experience violence, they may ask themselves, if I disclose, will anyone believe me? If I leave, where would I go financially? If I report, how will my younger sister or siblings maybe be impacted, or how will my family be impacted in general? If I seek counseling, will confidentiality be protected? These kind of pieces, right? Even, and something that I think sits heavy with a lot of different folks beyond the South Asian community is about, if I speak out, will my entire community define me by this moment, right? So these are not just irrational fears, they're very sophisticated survival assessments. And so when lived experience shapes policy, interventions become more intelligent and more applicable. And so we would create this space where there could be more discrete access points, trauma-informed care, maybe financial pathways to independence, and staff trained to navigate this type of complexity without judgment. And this also changed the tone. So communities do not want to be pathologized. All communities and communities within the South Asian areas as well, they contain resilience, brilliance, care, and internal diversity, right? So we must never make discussing harm for defining a culture by harm, So the most the most effective systems are those that see people not as cases to manage, but experts in their own realities.
Absolutely. And alongside this theme regarding diversity, you discussed during your presentation how overlapping identities shape vulnerability. And I'm wondering, how can policymakers and practitioners meaningfully integrate intersectionality into real-world programs?
Yeah, this is a really excellent question. In my research and in my professional experience as well, as a clinical social worker and as a community worker in general, I find that intersectionality is one of the most valuable analytical tools we have because it helps us to move from generic policy to precise policy. And so too often, systems categorize folks in singular pathways, right? Youth, women, immigrant, disabled, these kind of pieces, right? But folks don't live singular lives. They live at intersections. And it's often at those intersections that this vulnerability or resilience is produced, right? So, for example, being a young woman may shape risk, right? So, this may shape how institutions respond. And so, it's one of those pieces where these experiences do not simply add together, right? They interact with each other. And so when we operationalize intersectionality, we first need better data, right? So if all outcomes are aggregated under, quote unquote, for example, woman as a gender, then women with the greatest barriers will disappear statistically, right? So this precision matters. And second, frontline systems also need more decision making flexibility. And so often sometimes standardized models can create barriers to pursuing specialized treatments or specialized interventions. And so you may lose opportunities to really see what services or supports could really advance or move the needle forward for somebody. And then lastly as well, representation really matters, right? When policy tables lack those most affected, blind spots become inevitable, right? So advisory boards, leadership teams, and research agendas should really also reflect real communities. And then the one last comment I wanted to make was around accountability mechanisms. And so, if a program is succeeding overall, but failing another group within that program, or you're seeing statistically that other groups are struggling in specific areas, then success is incomplete. So I think intersectionality is essential for policy accuracy and service provision because it really helps us to design systems that reach the people that sometimes are aggregated or collated systems can miss.
Absolutely. And thank you so much for explaining the importance of operationalizing intersectionality and how specifically intersectionality can be integrated effectively into real world programs. Another notable theme from your presentation related to major challenges associated with fear, stigma, and systemic barriers. And I'm wondering, in accordance with your research, what are the most critical barriers you believe that are preventing young women from seeking support? And also, how can systems better respond?
Yeah, I feel like this is a large question, but I'll try my best to
Of course.
answer this in a way that's like succinct and kind of builds different ideas together. And so I believe that one of the most important things research teaches us is that barriers to seeking support are rarely about a lack of resilience or willingness. They're more often about, these barriers are more often about uncertainty, complexity, and perceived risk. And so many women are carefully weighing what could happen if they speak up, and that decision is shaped by multiple factors. The first major barrier is fear of consequences. So, seeking support can feel really daunting if someone is unsure whether the situation will improve, whether confidentiality will be maintained, or whether relationships at home, school, or in the community may become more strained. For many young people, uncertainty can be a very powerful deterrent. The second barrier is stigma and shame. In many contexts, discussing family conflict, relationship harm, or personal struggles can feel very, very deeply uncomfortable, right? And some women may worry that they may be judged, misunderstood, or seen differently if they disclose what they are experiencing. The next barrier is lack of awareness or clarity. So, not everyone immediately recognizes unhealthy dynamics, such as coercive control, emotional abuse, manipulation, or persistent intimidation. So, if someone cannot clearly name what is happening, they may not know that support is available or even appropriate for them. And so, this can really create a significant barrier as well. Another barrier is practical accessibility. Services may exist, but they can be really difficult to navigate, either due to language barriers, long wait times, transportation issues, financial constraints, or simply not knowing where even to begin. When someone's already under stress, complicated systems can feel more overwhelming. The last barrier I want to talk about is trust and comfort. Young folks are more likely to seek help when they believe will be listened to, respected, and responded to with sensitivity. If they're unsure of that, they may delay reaching out as well. And so this kind of leads up to your main question around how can systems respond more effectively. And so first, I would recommend simplifying access. Support should be clear, really visible, and easy to navigate. Second, I would invest in early education so young people can really recognize healthy and unhealthy behaviors in relationships, family spaces, and online spaces. Next, I would prioritize confidentiality, showing empathy, and consistency in frontline responses. The first interaction you have with someone or a youth often determines whether someone will continue seeking help. And the last point I wanted to make was around expanding responsive and multilingual services. So support feels relevant and approachable, right? So I think ultimately people seek help when the pathway feels safe, respectful, and manageable. And so our responsibility is to make that pathway as clear and compassionate as possible.
Absolutely. And as you're aware that some of the central mandates of the Alliance Against Violence and Diversity involve breaking down these systemic barriers to seeking support and alleviating fear and stigma. And I believe that your research and your elucidation of these findings and policy recommendations are all valuable in these regards. Along these lines, you also highlighted during your presentation that policies often exist to support those affected, but implementation varies widely. And I'm wondering specifically, where do you see the biggest disconnect between policy intent and frontline practice?
Yeah, this is another great question. I feel like we're eternally always reviewing and thinking about this question. We want to make sure the policies we're creating are actually translating well and creating impact at the front line and frontline practice. And so I think one of the most common challenges many sectors experience is that strong policies set a very important vision, but translating that vision into consistent day to day practice can be complex. And that disconnect is not usually about intent, it's more focused around kind of execution, coordination, and capacity because many people and many sectors, interdisciplinary sectors, are involved with carrying out these policies, right? And so there's a lot of different folks involved, which requires a complex response. And so the first gap I often see between broad principles and practical application. Policies may really emphasize concepts such as trauma-informed care, cultural responsives, or survivor-centered support. And frontline professionals also need clear guidance on what those principles look like in real conversations, time-sensitive decisions, and high-pressure environments, right? So without the practical tools, even well-designed policies can be really difficult to apply consistently. The second challenge is in variation in resources and capacity. And so different organizations, schools, clinics, or community agencies may be working with very different staffing levels, right? Very different training opportunities or funding realities. And so as a result, the same policy can produce very different experiences depending on where someone seeks support. Another disconnect is fragmentation between the different systems that are interacting. Many issues related to violence prevention and well-being involve multiple sectors: healthcare, education, social services, justice, housing, and community organizations, right? And so when these systems operate in parallel rather than in partnership, individuals can experience delays. They have to often repeat assessments, or there's this unclear pathway to care, right? Because folks may be accessing at various points within the different systems and then may have to kind of shift and navigate through like where do I go for what supports I need, you know? Another challenge is measurement. Organizations often track different pieces, but outcomes like trust, confidence, safety, long-term stability are really hard to measure, right? And even though they're often the most meaningful indicators that we think about when we think about success. And so overall, like I think consistency matters. Policies may be really strong at the leadership level, but people experience systems through individual interactions, right? That first phone call, that intake meeting, working with different teachers, nurses, counselors, or caseworkers. And so those moments shape whether a policy feels real or only theoretical, right? And so the big question I think that keeps all of us up at night is around like how do we close that gap then? I would recommend, pairing policy with practical implementation plans, investing in regular training and professional development for staff, strengthening collaboration across sectors so people experience joined up support rather than separate systems. And then also including feedback from frontline staff and service users because they do often see the barriers earliest and most clearly because they're directly experiencing them. And so overall, policies really create this direction, but implementation creates experience. And so the real measure of success is what people feel and the outcomes they're able to achieve when they reach out for help.
Absolutely. And thank you so much at the present moment and also during your webinar about emphasizing the importance of connecting policy intent to frontline practice and strategies in order to ensure that these imperative policies are implemented as effectively as possible in frontline practice. So along these lines, I'm also wondering how can community-based organizations and culturally grounded approaches better support prevention and intervention, especially in diverse and multilingual communities?
Yeah, yeah, for sure. This is like the next natural extension, right, of policy implementation and frontline work, right? And so we see that community-based organizations play an essential role because they're often closest to the everyday realities of the people who how they serve. You see in practice that community-based organizations frequently have long-standing relationships, local knowledge, and a level of trust established that can make accessing support more approachable and less intimidating, right? And in many cases, they're the first place folks will turn before engaging with larger institutions. And so one of their greatest strengths is accessibility. Community organizations are often integrated into neighborhoods, schools, faith spaces, settlement networks, or cultural communities. And so this proximity allows them to identify concerns early, really respond quickly, and build relationships over time rather than only during moments of crisis. And when we think about culturally grounded approaches, they're very valuable because effective support should reflect the realities of the people who are receiving it. And so they can include language access, understanding of family structures, sensitivity to cultural values, and recognition that help seeking may look very different across communities. And so for some individuals, support may begin through counseling. For others, it may begin through mentorship or educational workshops. But I just want to be very, very clear, right? Culturally grounded does not mean culturally deterministic, right? Communities are not monoliths. It means responsiveness, humility, and establishing this partnership, right? And so in multilingual communities, language access is especially important. Clear communication builds confidence, reduces misunderstandings, and can help make individuals really help them make informed decisions about their lives. And in many cases, these are really, really large decisions, life-changing decisions. And so when support is available in someone's preferred language, it often becomes more welcoming and supportive for them. We also see that community organizations contribute significantly to prevention efforts. Because they're connected to local networks, they may notice early signs of isolation, school disengagement, emotional distress before those concerns escalate, right? So early support can make a major difference. And so to strengthen this work, larger systems can partner with more intentionally with community organizations through shared training, maybe referral pathways, coordinated outreach, and different types of funding models. And so collaboration tends to be more supportive when community organizations are viewed as equal partners with valuable expertise, right? So prevention and intervention are the strongest when support feels respectful and easy to access. and community organizations are often very uniquely positioned to create and sustain this environment.
Absolutely. And thank you so much for highlighting the importance of collaboration with community-based organizations and also listening to their needs when, for example, policymakers and those involved in the provision of resources to community-based organizations are supporting prevention and intervention efforts, and also for effectively contextualizing for the AVA webinar audience and the podcast listeners how culturally grounded approaches can better support prevention and intervention. Also, from your webinar, I found that your use of arts-based inquiry was really powerful. And I'm wondering, how can creative methods contribute to violence prevention and healing in ways that traditional approaches may not?
Yeah, yeah. And for me, this is something that is a core part of my research inquiries and my explorations. I've seen art reach places that policy reports cannot. We see that trauma is often sensory, emotional, and difficult to narrate linearly, right? So asking someone to explain pain in a formal interview can be limiting, but asking them to photograph safety or draw what silence means to them, write spoken word about belonging, or map their emotional landscape creates entirely new forms of truth. And when we look at arts based inquiry, it's powerful because it also restores agencies. And so folks are often reduced to what happened to them or their experiences, these kind of pieces, right? And so creative methods allow them to become authors of that meaning. And for prevention, art can interrupt harmful norms, right? So a theater performance about violence can reach audience emotionally in a way that a pamphlet won't, and a youth created film about online radicalization can resonate more deeply than, perhaps a more traditional form of learning. But I'm not saying that one type of learning or kind of promotion is better than the other. I'm just saying that there's different ways to share information and create impacts. And so for healing, creative practice supports regulation. It can really identity build connection, and expression beyond words. And so it can be really communal as well, without requiring disclosure. And so globally, some of the strongest peace building initiatives have used storytelling, mural work, music, and performance because art humanizes across difference and it creates a space to make empathy possible, right? And so I like to think about it this way: data can tell us what is happening, but art can help us to understand why it matters. And that, for me, that's how I hold both together.
Absolutely. And thank you so much for educating our audience about the importance of arts-based inquiry within your work and broadly speaking within the realm of gender-based violence prevention and intervention. And finally, as a concluding question, to synthesize your presentation and responses to these questions, if you could prioritize one or two key actions for governments, organizations, and communities right now, what do you believe would have the greatest impact on preventing violence and supporting young women?
Yeah, yeah. I think if I had to prioritize, the first would be early and sustained investment in young people's well being. So, prevention is most effective when it begins before crisis emerges. So, that means creating environments where young women feel safe, connected, and able to access these opportunities. I think sometimes we underestimate belonging because it sounds abstract as a metric, but in reality, it is very structural. When young people can feel seen, connected, purposeful, and valued, vulnerability to violence significantly decreases. And this can include strong schools, mentorship programs, mental health support, recreation spaces, leadership opportunities, and employment pathways. And so these may seem like separate investments, but together they form this social foundation that helps reduce vulnerability and build resilience. I think my next priority would be making support systems easier to navigate. Many individuals who need help are already carrying significant challenges. And so if services are fragmented or difficult to access, people may delay seeking support or even disengage altogether, right? The most effective systems are coordinated, clear, and person-centered. Health services, schools, community organizations, and legal information should work together so individuals can experience support as connected rather than confusing. And so I would also put forward the importance of listening to young people themselves. Programs are designed for youth rather than with youth in some cases. And so young women understand the pressures they face, the language that resonates, and the types of support that can feel helpful. And so their voices should be central to prevention efforts. Prevention requires truth-telling, right? And finally, I think we really benefit from seeing prevention as a long-term investment rather than a short-term response. And so when communities can invest early in well-being, inclusion, and access to support, the benefits extend far beyond violence prevention. It really becomes this community-building strategy. And so if I were to summarize, I would say invest early, make support accessible, and listen closely to the people who we're trying to serve. Those three actions, I think, can have a transformative impact.
Absolutely. And thank you so much for emphasizing the community-based benefits that are associated with sustained early investment and accessibility of services and listening to those to whom these important violence prevention services will be provided to, along with the importance of properly coordinating these services. So, on behalf of the Alliance Against Violence and Adversity, I'd like to thank you for joining the HERHealth podcast today and for your valuable insights. Is there anything else that you think would be of importance to mention as we wrap up the podcast today?
So, I think this was great. Thank you so much for your questions. They were so well positioned and really revealing. So I really appreciate the opportunity to come and speak with you today and record this podcast. It was really, really a pleasure to be here.
Likewise, and thank you so much for joining us today to share the valuable insights from your presentation on approaches to youth violence and radicalization prevention in Canada through a public health lens. Thank you so much.
All right, thank you as well, Jason.
Thanks for joining us on the HERHealth podcast, transforming health for women and girls at risk. Remember, your health matters, and together we can make a difference. Until next time, remember to prioritize your health and well-being. For more resources and support on issues affecting girls, women, and gender-diverse people, visit our website at avatraining.ca. This is Dr. Nicole Letourneau. Thank you for listening.